I've tried to make this a very interactive talk, so I'm going to be doing some demonstrations. I've got a few assistant props with me. One is Captain America, and I've also got a little COVID virus particle. So first of all, I would like to say namaste and vanakkam to everybody, and kia ora from New Zealand, and thank you very much for inviting me to speak on this extremely important topic, which is lessons learned from the first and second wave of COVID-19 and the successful models to mitigate the third wave impacts. Now, this is incredibly important because we should always endeavour to learn from the successes of history and not to repeat its mistakes. Now, on this slide, you'll see on my title slide, I've got a picture of the Indian flag, which was projected on Matterhorn Mountain in Switzerland. And this was done on the 18th of April in 2020 by a Swiss artist in a sign of solidarity with while India was suffering from its first wave. Now, as terrible as the first wave was, and even at that time we had some overwhelmed healthcare resources, the second wave, which India has just come out of, was colossal, and I don't think there was any Indian, not just in India, but all over the world, who was not personally affected, in that somebody in their direct circle who lost their life during this extremely tragic wave that India has just survived. So it is very, very important that we learn the lessons and we don't go back there again. So what's different about the pandemic today? Now, in 2021, the whole story is now new. It's all about the vaccines and the variants. So we've been very, very lucky that vaccines, which we never had a guarantee of finding, not just one, but multiple highly effective vaccines have been found that can prevent us, getting severely ill or dying from COVID. But at the same time, the virus itself has, upped the challenge by, doing what a virus normally does and mutating. And we have these much more infectious variants which we're dealing with, which is causing havoc and spreading like wildfire around the world. So COVID, the good news, is now a vaccine preventable disease. And so it is very important that everybody gets vaccinated as soon as possible so that we are protected against having bad outcome with COVID-19. Now we can see in the statistics that this has now become a pandemic of the unvaccinated. So although people who are vaccinated, you are seeing reports of breakthrough infections occurring, this is 99.5% of the cases where people are actually having a bad outcome are happening in people who are unvaccinated. And as I mentioned, we are now contending with much more infectious viral mutations, such as the Delta variant, which was responsible for the tragic wave that India just suffered. We also have much more knowledge about the virus itself now, about the modes of spread, effective treatments, and also the long-term impacts of the virus. So, I would say that the main weapon that we've had in fighting this virus is knowledge. So what were the lessons that were learned from the first and second waves? And how can we apply this towards the mitigation of the impact of the third wave? Well, I think the first lesson that everybody should take to heart is that we shouldn't underestimate the virus. The virus, unlike humans, only follows science. It doesn't follow politics. And so it just keeps doing, what it does. Whereas a lot of the time where humanity has failed, it is that there has been policies which have been, created or dictated that are not based in science, and they are always bound to fail because in a pandemic, there is only one truth, and that is science. We've also learned that prevention is better than cure. I mean, the race since the pandemic hit was not just to, get a vaccine, it's also to find a cure for this disease. And while we have come a long way in understanding how better to treat it, there is still no cure for this disease, and the best mode of action is prevention. We've also learned that overwhelmed healthcare resources have disastrous consequences, and that is what India has seen. And I think people didn't probably understand that a lot of the reason for lockdowns initially, which were pretty broad sort of, blanket defenses that we were using against the virus, were because the worst possible thing that can happen, and the thing that we have to protect at all costs, is our health infrastructure, because once that becomes overwhelmed, then even the cases which are, mild to moderate can end up having a very bad outcome, as we saw in India, because you are not able to access your basic health care. So one of the biggest lessons that we need to learn and relevant to India is that in investment in health infrastructure, building our surge capacity, making sure that our healthcare resources are, bolstered. And as we mentioned in my introduction, part of what I did during the second wave was help establish a global medics for COVID, where we tried to, address the problem where we were having, overwhelmed healthcare resources and doctors, that were overwhelmed, and trying to tap into that brain power from overseas and, provide real-time assistance to patients. And, that is moving from strength to strength, and, is something that we can look at, utilizing more in the future. Now, the other very important lesson is that controlling the virus requires a multi-layer approach. No single method is successful on its own, because no single method is infallible. So we need a combined approach. Vaccines are brilliant, but they alone are not 100%. We need to keep up a multi-layered defense in order to mitigate the effects of the third wave and to carry on safely navigating this pandemic. So why are we talking about waves? Now, I mean, the COVID-19 pandemic, and any pandemic, just as the Spanish flu, which occurred over 100 years ago in 1918, it lasts several years, and they tend to come in waves. Now, what happens basically, you can see in this diagram, we have some very gifted scientific educators in New Zealand, and they've come up with some very good diagrams to explain to people. So the natural history of what happens in a pandemic, you can sort of see as we go on this diagram. You have a good collective response. You manage to bring down the reproductive rate of the virus so that, we control it and we, flatten the curve. But then as people relax and become complacent, again, the, infections build at an exponential rate, and we are at risk of overwhelming our health systems again. So what has been the game changer? Well, the game changer at this stage of the pandemic is that we had, and for a lot of the reason why we were in this holding pattern for the last two waves of just trying to flatten the curve and stay at home, was that we were allowing scientists to we were trying to get time to develop these, a cure or a prevention, and the gold standard is vaccination. And we were able to find not just one, but multiple highly effective vaccines. Now, just remember that WHO would have approved any vaccine which was had a 50% efficacy, and we've been able to develop vaccines with over 90% efficacy. So that is very good news. Now, vaccines, as you know, they are just introducing a small piece of genetic material into our body, which basically trains our immune system to recognize the virus and then fight it off. What is the end game that we are looking for? The end game we are looking for is what we are calling this terminology of herd immunity. And that refers to, you can see in this slide, before herd immunity, the pink sheep are the ones that are immune, and by vaccination or by natural infection. But natural infection doesn't provide a lasting immunity. But through a combination, you only have a few people that are immune. But once the vast majority of the population is vaccinated, then you have a lot more pink sheep, and basically that virus is unable to spread through the community. So that is what the end game we are looking for. But the important thing to understand is that herd immunity is not one single point in time. And we are talking about an entire population of, the entire planet. And you are going to have places which are going to have, more progress than other places. But it's very important to understand if there's any single pocket in the world where we're having uncontrolled spread, then that virus can mutate and create a mutation which can then spread to other parts of the world where, they think they may have reached herd immunity before. And again, they could be, back to where they were before. So this is a process. Now, as I mentioned, to control any pandemic requires a multi-layered approach. And this was a beautiful diagram, called modification of the Swiss cheese model, which was drawn up by virologist Dr. Ian Mackay in Queensland. And he's divided this nicely into personal and shared responsibilities in order to control the virus. So we have things like, your physical distancing, staying home if you're sick, your masking, your cough etiquette, your hand hygiene, and, avoiding crowds, limiting your time in, crowded areas. Then, of course, there's your testing and contact tracing. And now, of course, the importance of ventilation and air filtration, which I'm going to talk about in a little bit, is becoming very important, as well as government messaging, financial support, your border controls, and of course, the gold standard, which is vaccination. So now I just want to take a few steps back and explain to everybody exactly what we are contending with in terms of the science. And in order to do that, I've just got a little assistant with me, which happens to be Captain America. But basically, what you have to think of is that, currently humanity is in a war against this COVID-19 virus, okay, which looks a little bit like this. Now, in a normal war, you have, you tend to send the fittest and the healthiest of your troops to war. But as you can see in the diagram that I've included, in this war, if you can imagine your battlefield with the entire humanity, it is not just the fit and healthy. We have, children, babies, pregnant women, elderly people, people who are disabled, people who are, who have other diseases. We are all on the same battlefield together. Now, in order to fight any war, you don't just use one weapon, you use many weapons, because one weapon alone is not enough. And the other thing that's very important is that you need to understand both the strengths and weaknesses of the enemy. Now, you can see I've included a picture of a soldier in the trenches, and you can see he's got his, his kit on, he's got a gun, he's sitting in a trench, and, he's got various other weapons with him. So if we speak broadly, originally at the beginning of the pandemic, the main weapon we had when we didn't really know much about it was these stay-at-home orders, which is something similar to, staying in a trench. Basically, you are trying to, if you imagine that your little COVID virus particles are like bullets, and you're trying to prevent them entering your system, staying in the trench is, the broadest way to basically avoid, actually being penetrated by these, virus bullets. Now, just to go over what is our enemy, I just want to, again, it's very important that everybody, even children, understand exactly what we're contending with. So the virus basically looks something like this, but this is, hugely magnified, because in one drop of seawater, you can have up to 10 million virus particles. The virus alone cannot harm us. It can only replicate if we allow it to enter our system. And it generally enters through our eyes, our nose, and our mouth. Now, the virus basically has a protein shell on which there are protein spikes, and inside it has a strand of genetic material called RNA. It also has a fatty envelope on the outside. Now, the fatty envelope on the outside is a point of weakness, and that's why we were told that we need to wash our hands with soap and water or 65% alcohol, and with the soap and water for 20 seconds before touching our eyes, our nose, and our mouth, to prevent any virus particles that are on our hand to go into our system. Now, why is it important? That is because the way this virus works is that these little spike proteins that you have here, basically they are a key, and the locks are on the ACE2 receptors, which line the cells inside our eyes, our nose, and our mouth, and are present in other parts of our bodies. But that is basically the portal of entry. So these little spike keys turn the lock, enter our cells, then they hijack our genetic material and replicate and create, thousands and millions of copies of the virus and send it around our body. And that's a terminology that I'm going to explain. When this happens, then we start shedding, a certain amount of virus, which they call viral load. Now, the important thing to realize is that the only weapon the virus has is humans, okay? You and me. Now, at the beginning of the pandemic, the main mode of spread was thought to be, surface was thought to be droplet spread. So large droplets, which we expel basically when we, talk or cough or sneeze. And that's why we had this 2 meters of physical distancing, because most of those droplets were meant to fall before the 2 meters. And then the other thought was the surface transmission. But what has become evident is that the main mode of spread is aerosol spread. So when we talk, we emit a fine mist, which you can imagine just like, smoke, like somebody who was smoking. We are constantly emitting this fine mist, which contains these aerosolized virus particles, which concentrate over time in an enclosed space, and also dependent on the volume at which we are speaking and the number of people speaking. So again, if you're trying to think of it in terms of, if you've got my soldier here and say that he needs about 100 virus particles inhaled to be infected, that would be the viral dose required for him to come down with COVID. And then when he got sick, he may be then emitting a certain number of, these virus particle bullets. And at the beginning of the pandemic, what we had was basically just these behavioral weapons, which were actually very highly effective at preventing the virus particles from entering. As I said, it was washing our hands, it was watching our distance, and it was wearing our mask. And arguably, wearing the mask was the most important thing, because this became our personal lockdown and allowed us to continue. And it remains a very important defense. Now, not only does it prevent viral access, the mask actually also reduces viral dose. So even if we are sitting in a room where, we have a lot of these virus aerosols, by wearing a mask, we've reduced the number of virus bullets that enter our system. Why is that important? Because the lower your viral dose, the less severe your infection will be. So that is an extremely important concept for people to understand. Now, what happened during India's second wave? So in the first wave, at the beginning, the original strain of the Wuhan virus, we had this tree diagram represents exponential spread. So one person would spread the virus to approximately 2 or 3 other people. So once the virus has turned us into our own, human weapon, we are then able to infect another 2 or 3 other people. And then they are able to go and infect another 2 or 3 other, and so on and so forth, till you get this exponentially growing tree of infections. Now, what has happened is with the Delta variant that originated in India, we have more than double, at least double the infectivity. So as you can see on this tree diagram, which I've mirrored, and I've done it backwards so that you can understand that it's not just forward facing. These virus particles are all around us in the room. So me talking at the moment, if somebody was sitting in front of me, they are not the only person that's at risk from if I was infected from my aerosols. Somebody standing or sitting behind is also equally at risk. So that is also another very important concept to understand. So you can see here why we had this, explosive spread, uncontrollable spread that occurred. So the thing with the Delta variant, what we're contending with now is it's fast and it's furious. It is more transmissible, at least 2 times more transmissible. You have people with much higher viral loads. So your person who may have been only expelling 100 virus bullets before is now expelling 100,000 virus bullets when they're infected. And if people only need 1,000 viral bullets to get infected, that is a lot more bullets to dodge than there were before. Also, the other thing with the Delta variant they found is that the incubation period is much shorter. It's gone from 6 days to 4 days. So there is far more pre-symptomatic spread. And that's what they're finding now in the outbreak that's taking place in Australia, for example, which, Sydney is my hometown, is that it's getting much more difficult to contact trace because, it's very hard to stay ahead of the infections. And the other problem is that the vaccines that we have developed are now, slightly less effective because people are shedding these higher viral loads, and these viruses are getting a little bit better at evading the vaccine immunity. So in order to avoid becoming a statistic, there's really 3 groups of people. We need to build our Delta wall and get our populations vaccinated as soon as possible. So really there's 3 scenarios. Either you are fully vaccinated and you're behind a fully protected Delta wall with 2 vaccine doses, or you are partially protected in that you've had 1 vaccine or prior COVID, or you are in the highly vulnerable group where you've not had a vaccine. Now, I just want to highlight that there's 4 groups of people in that group. That includes people who are not yet eligible, and the biggest group I would say then is children. In India, currently, the vaccine is only been approved for people, adults over the age of 18. Then you have, of course, your people who are unable to take the vaccine because of underlying health issues. Then there are people who are unable to access the vaccine due to, inequitable access. And then, of course, the big group, which we can't afford to have, which are the people who are hesitant or to take the vaccine or the anti-vaxxers. And we need to really minimize this group through strong education campaigns. So now going back to my battalion analogy, so we were very, very, as I said, we have been extremely lucky that scientists delivered this miracle feat of vaccines. Now, just to explain the science of herd immunity, I'm just going to explain. So the vaccine is, you can think of it as a shield. Now, before, in terms of, our mask and our hand washing, all of these weapons that we had were basically aimed at preventing the virus access into our body. And the good news is, that they are very highly effective at doing that. I mean, your premium mask, for example, your N95, can pretty much block almost 100% of viral bullets if it's used properly. Now, there are no weapons other than vaccines which can actually help us if the virus does manage to enter our system. And so this shield is extremely important. Now, people get confused that there are many different vaccines. The way I'd like you to think about it is that they're just different designed shields. But some of the shields perhaps are bigger than others, all right? Now, the benefit of the shield is not only does it protect the individual, this shield protects others. So if you go back to imagining everybody on the battlefield, and you have, a proportion of the battalion who are holding these shields, many more of the people will be protected from these vaccine bullets. From these viral bullets. Now, with the more contagious variants, you've got to understand that the mathematics behind it is that the percentage, people are always asking about, what is the magic number? What is the magic percentage of the population that needs to be vaccinated before we reach herd immunity? Well, that all depends on first of all, how, transmissible this virus is. And the more transmissible it is, the higher the proportion of population that need to be holding up these shields or vaccinated. The other mathematical variable is the efficacy of the vaccine. Now, as I've explained, the variants are evading some of the vaccine efficacy, and they are causing the diameter of the shield to reduce. So if you can imagine back on the battalion, whatever shields the people are holding up, they are now slightly smaller. So more people need to be holding up shields. So, and the other thing is, even though, I mean, your soldier here has now got his shield, if you are raining bullets in that, battlefield, you are not going to go naked on that field just holding the shield, because this is not 100% protection. Yes, hopefully it will protect you from getting that shot into the heart that will kill you, but you need to still retain the other forms of protection. And the other point I would like to bring here is that it is our responsibility to protect those that are vulnerable and that they cannot be vaccinated or cannot have access to it. And the biggest group by far at this stage is children. And I have made up this diagram for my last NIDM talk to explain this. It is our responsibility to shield the children throughout this pandemic, because they deserve, a healthy future. And what we're seeing in India is that, yes, the infection rate did come down, probably because, so many people got infected, but the breakthrough infections will happen and repeat infections will happen. And now these people are traveling around unmasked. And even if you are fully vaccinated, you are able to get a breakthrough infection and then bring it home and infect your children. And it is not true that children are not getting the long-term effects of this illness. Children, we've just seen in Indonesia, which is currently the epicenter in Asia, that a lot of children are dying. Hundreds of children are dying, and some of them under the age of 5. So it is very essential, and it is the responsibility that we continue to protect our children by remaining informed and using every method to mitigate this virus as we possibly can. So as I mentioned, it is very important that not only when we have more transmissible COVID strains, it's not just important to use the same weapons. We need now better defenses. So not just more of the same, we need to be doing better of the same. And I know everybody is exhausted and tired, but this is extremely important. So I think the big shift now, and what we have to focus on, is that the 3 most important strategies going on ahead is vaccination, masking, and ventilation. And I'm just going to explain to you why. So vaccination, as I said, is very, very important because, this, as I said, prevention is better than cure. Governments need to fight vaccine hesitancy and vaccine inequity. We need to be very targeted. And in India, I mean, they've had success in the past. They need to target vaccinating, healthcare workers, potential super spreaders first, and, using safe vaccine clinics like, possibly drive-through vaccines or outreach where you're actually going to, knocking on doors and basically getting those vaccines into arms. I think India's doing an incredible job at vaccinating 4 million people a day, population of New Zealand, but due to the vast population, that needs to keep ramping up because this is a race against time. Now, masking is extremely, extremely important because, as I said, premium mask, like an N95 mask, is effective at blocking almost 100% of these viral bullets that come our way. Now, initially, your just, plain surgical mask was mainly designed at preventing your aerosols, your droplets from leaving, but the premium filtering masks basically protect both ways. But what I'd like to highlight is that mask fit is very important. Wearing, so you don't need to go out and get an N95. I have a video where I've demonstrated how to put a surgical mask and do a few knots to make it fit tightly. It must not be leaking, and then you can double mask by putting a cloth mask Mask hygiene is extremely important. You know, we saw this epidemic of mucormycosis and, and a lot of this was because of, just treatments that were rife, probably not based in evidence, as well as possibly, problems related to hygiene, whether it would be with masking or, with oxygen cylinder use, etc. So we need to increase the effectiveness of the masks rather than giving up masks altogether. We should be wearing now masks, and they should be better masks. Now, very, very important topic is mitigation of these COVID aerosols through ventilation. Now, in India, because of the sheer, population, social distancing is very difficult. So wherever possible, wherever we expose ourselves, we should make sure that the air is fresh, it is filtered, and it is flowing. And we should try and prefer outdoor locations over indoor. So rather than, the whole emphasis was on sanitizing our hands and sanitizing our surfaces. I'd like to think people to now think about sanitizing the air we breathe and knowing the air. You should know the air, and you should try not to share your air. So here I've just included a couple of pictures. A few countries like Belgium have mandated businesses display these CO2 monitors, which are relatively cheap devices, and they've got this beautiful, traffic light system. So, when we expel CO2, we have these CO2 monitors. It's an indication of, a rough indication of what the viral load of that room is. So if the, the CO2 reading is going above 800 parts per million, it's an indication that we need to open the windows and allow fresh air to dilute the virus particles. HEPA filters and MERV filters are another very useful way to sanitize the air. And I know in India, due to pollution, etc., a lot of households actually have these air filters and air purifiers in their home, and I understand a lot of them have these built-in, CO2 detectors. So, populations should be, educated about how to use them. Businesses should be made to display them, and this will go a long way in mitigating risk alongside all the other methods. The other ones is also, of course, we still need to clean, wash our hands and, teach children, particularly before touching our eyes, our nose, and our mouth, keeping a social distance whenever we can. And of course, self-isolating, especially when we are sick, for any viral symptoms. Now here I've just included this slide, is that now we are contending with 3 different populations of people. We're dealing with people who are fully vaccinated, partially vaccinated, and unvaccinated. So now we are getting a whole different set of COVID symptoms, and also along with the variants. So, people, you cannot assume that any viral symptoms whatsoever, so even the people that are now fully immunized are getting things that would just come across as a little bit of sneezing and maybe a little bit of a sniffle. That is actually a COVID infection. So, and that's how we're getting 100%, transmission in households, and that's why children are getting infected, getting affected so badly as well. So the minute you have any viral symptoms, please get tested, wear a mask, and isolate yourself from families. India can improve on genome sequencing. I think part of the reason the second wave happened, so it was such a drastic consequences, is because we were going blind. Only 1% of the samples, I think, were being actually sequenced, and it is very important to keep on top so we know exactly what viral, variants we're dealing with, and we can, change our behaviour accordingly. And testing, tracing, safe socialization, these are all important responsibilities, not just on a personal level, but on an organizational level and on a government level. That super spreading events should be avoided at all costs, because the nature of COVID-19 spread is, even though, some people are having, higher viral loads, the tendency is that it tends to spread in clusters. And as we see, weddings and, prayer meetings, funerals, these are the places where lots of people have got infected. And the people that ended up dying are often the ones that never attended. They are, relatives of people who attended a wedding and they ended up dying. I just wanted to bring up this very important point, which is the COVID triangle and managing your risk profile, that each and every one of us, that we have to think of ourselves as in a triad between us, the virus, and the environment in which we are exposing ourselves. Now, to control the risk of the virus, we can now get vaccinated. And I suggest, those who are eligible get their COVID vaccine as soon as possible. And of course, now I've already gone through the environments. We should avoid risky environments where we are sharing air with people outside our bubble. We should minimize our viral dose by minimizing our duration where we expose ourselves. But it's very important that we also focus on ourselves and our health and building our own fortress, which is still our #1 defense in fighting the infection. And that is making sure that we eat well, we sleep well, that we remain connected with our family, that, for children, we continue their childhood, other immunizations, that our vitamin D levels remain adequate. And, basically, we are focusing that, this is a marathon, that we have to keep ourselves in top shape, basically, so that if we do have to fight this infection, our immune system is primed and ready to go. And the other very important thing which I want to highlight is that viruses, they're not living things on themselves. They're not sitting there and theorizing how we're going to defeat humanity. We're doing a pretty good job ourselves. The virus cannot mutate if we don't allow it to replicate. So the more that we allow uncontrolled spread, the more we abdicate our responsibility and allow other people and say, look, I don't really care, is the more we are giving this virus the chance to mutate further and possibly, worst case scenario, defeat even our vaccines. And I would like to highlight that, as bad as Delta variant was, this may not be the worst variant which this virus has to deliver us yet. So it is up to each and every individual to do their bit to, stop the spread of COVID-19. Because we may not be able to control, we may feel that we may not be able to control much, but we can always, always control our own behavior. And, just on this today, CDC has released, and a lot of people in India were like, oh, America said we could drop, masking. America has reached almost 50% vaccination. India has not even reached 10% of the population. And if you can imagine your battalion, only 10% are holding up these shields. It is not the time to drop all your other risk mitigation. So they have now modified and said that, communities and organizations should update their prevention strategies based on multiple different, factors, which include the rate of community spread, the capacity of the healthcare system, the vaccination coverage. When you start seeing the uptick of cases, as we are seeing in India, which is heralding the third wave, and also how much of your population is at risk. So if you have a population with a high vaccination rate and a low community spread, then there is less need for all the other mitigation. But what India's scenario is at the moment means that we need to use every weapon in our arsenal. And once we understand that, we just keep carrying on. We just do what we have to do until we get to that point in time where we can slowly let these things go. So yeah, that is basically what the message I wanted to convey to you all today.
Thank you, ma'am. Thank you very much. That was such a wonderful presentation. I must say that it was a feast for the eyes and ears of the viewers. Thank you, ma'am.